just wanted to share that what this is about, it's an initiative of Peninsula Temple Shalom, where it's a community building experience where stories, information, education, and support resources are shared with and among those who live with mental health concerns and those who have family members who live with mental health concerns and or know folks who are friends or colleagues that mental health, mental illness really touches many of our lives in different ways. And this is an opportunity to share and learn from one another. As your moderator today, I would like to start by giving you a heads up of what our agenda is. We have 4 panelists who I'll introduce briefly, but then I'm going to ask each of them to introduce themselves, tell us a little bit about their role as it relates to San Mateo County Mental Health Services, as well as a little bit about themselves and why they're in this business of working with mental health, mental illness. And then they're going to share some information about key initiatives and some of the challenges that face us today, and the initiatives that are underway to address those challenges. We will then have a question and answer period where all of you will have an opportunity to ask questions of any or all of our panelists. I want to emphasize this is an opportunity to ask questions, not share information per se. And so we will be asking you, as Rabbi Delson indicated, to raise your questions through the chat line. If you're calling in and don't have access to chat line, I'd like to ask you to alert us that you would like to ask a question by saying something like, "This is David, I'd like to ask a question," and then wait for us to call upon you, and then we'll give you that opportunity. Before ending, we'd like to ask you to share your contact information with us, and at the end of the session, let us know how we did, what worked well, what didn't work well, and send both your contact information so that we can keep you apprised of future sessions, and send us your evaluative comments to Marcy, M-A-R-C-I-B, the letter B, at Comcast.net. Again, that's marcyb at Comcast.net, all lowercase. With that, we have actually a little surprise on our panel. We have not 3, but 4 guest speakers with us today. Supervisor Dave Pine, County Supervisor Dave Pine, also Dr. Anna Nataleski and Reverend Bill Crucy, and then a special guest, Mr. Scott Gilman, who is a Director of Behavioral Health and Recovery Services in San Mateo County. And together, we will learn from each of their perspectives what's going on and what are some of the challenges that we should be aware of, as well as opportunities for community members to be engaged in the efforts going on in our county. With that, I'd like to ask Supervisor Pine to please start with an introduction of your official role as it pertains to mental health work in San Mateo County, and a little bit about why you are interested in this topic. Supervisor Pine.
Okay. Well, great. It's really wonderful to be with everyone this afternoon. Again, my name's Dave Pine. I've served on the Board of Supervisors since 2011. And pretty much since the beginning of my service, I've been very involved with mental health issues in a couple of different capacities. I'm the liaison to the Mental Health and Substance Abuse Recovery Commission, and also serve on the Mental Health Services Act Steering Committee. The Mental Health Services Act, as I'm sure many of you know, is a funding mechanism to provide extra revenues for mental health services. And one thing I think that's particularly interesting about our Mental Health and Substance Abuse Commission is it does combine both mental health and substance abuse, because as we all know, there's often co-occurring challenges, so where people have to address both types of issues. When I think about the root of my interest in mental health, I think it's founded in two areas. Back when I was in college, I did some volunteer work with people with mental health issues, and I think that really had a big impact on me. And I've always been inspired by people's stories and their courage and ability to deal with difficult issues. In addition, I've also been very interested in the intersection of criminal justice and mental health issues. Sadly, something like 20% of the inmates in the jail have mental health problems, and it's an issue of great concern to me, and it's another reason that draws me to this work. So again, great to be with everyone today.
David, you're still on mute, but I think you're telling me to go ahead, so I will. Good afternoon, everyone. My name is Scott Gilman. I am the Director of Behavioral Health and Recovery Services. And if you're not familiar with that, we're a division of San Mateo County, part of health. I have been in this position for just about a year and a half now. And I came here from Michigan and really very excited to get started. But found a lot of similarities and a lot of differences, between the two states. And there's some areas where San Mateo is light years ahead of the rest of the state, and then there's some areas where we're light years behind, the rest of the country. And so I'm hoping that I can bring value to the county as we move forward. And there's a lot of great things happening. We'll talk about that in a little bit. I think I was fortunate to get into mental health work when I was a little baby social worker. The first job that I had was bringing people that had spent most of their life in state hospitals. And so that was back before we had very many medications, and people didn't want those people in their backyard. So I did a lot of social justice work and really found that we brought people out of the hospital, but we hadn't had really good systems in place to keep them there. And so I've made it my passion is to have a community-based system. And it's not good enough just to have people out of the hospital. They have to be out of the hospital and have a life worth living. And people with mental illness want everything that all of us want. They want jobs, they want families, they want love, they want relationships, they want recreation, and they deserve that. And so that's what I view our system as is making that happen.
Thank you very much, and thank you for saving me there with my mute off. I'd like now to introduce Dr. Anna Nataleski, and please share with us your formal association with mental health services in San Mateo County and what drives you to be a part of this effort. Dr. Nataleski.
Yes, good afternoon, everyone. I'm so happy to be with all of you today. So I'm a clinical psychologist in private practice. I work with kids as young as 8 all the way into adulthood. I think the oldest person I work with right now is 88. And I work with a host of different issues. Anxiety and depression are some of the most common ones. But as you can imagine, across a lifespan, a lot of other things do pop up. So I work with people struggling with all kinds of different things. The other thing I do is I am co-president of the San Mateo County Psychological Association. And that's a really kind of exciting direction that I am lucky enough to be doing right now. It's a 1-year position, so it will end at the end of 2020. Excuse me, but one of the things that we're doing is really trying to be a support to the community in the midst of all that's going on. So I'll get a chance to talk a little bit more about some of the initiatives there, but I'm excited to get a chance to work both with people in a private practice setting as well as doing a lot of meaningful work in the community.
Thank you, Dr. Nataleski. And Reverend Bill Crucy, share with us, if you will, your story. How did you get involved in this stuff, and what are you doing in San Mateo County?
Yeah, for the last decade, I have been the co-chair of what's known as the Spirituality Initiative. The Spirituality Initiative started just 10 years ago. I've been with it ever since it began as a way of trying to recognizing that the person is a total human being, and that spirituality is such an important part. And so we began this as a way of acknowledging in the clients their spiritual paths. And so that's what the Spirituality Initiative is about. terms of my own personal, I've been in mental health. I mean, I am a pastor and I do have a church in Berkeley. However, probably most of my ministry has been in mental health. I've been in mental health for about 40 years. Prior to being the co-chair, I was the executive administrator at Cordilleras Mental Health Center, which is in Redwood City. It is both an inpatient with clients, it's a locked unit, but also has outpatient for people, just kind of a step down unit to transition people back into the community. Why? It's very personal for me in many ways. I had a father who had depression. And in the early 60s, when that was happening, the only treatment they had was ECT or shock therapy. I saw what happened around all of that. But maybe even more so, I had an uncle who was put in the state hospital in 1939 because he was gay. In those days, you know, there was one of the diagnosis was homosexuality. And so he was put in the state hospital in Missouri. I'm from Missouri. For 30 years. He was in and out some because I would go see him, or sometimes I'd bring him home to his mother's house and stuff, but my grandmother's house. But, you know, I saw his life basically being destroyed. In those days, they didn't know what to do since that was a diagnosis. Of course, we know today that that's just, well, I won't go into that, but it destroyed his life. So I watched my uncle's life being destroyed by the system was at the time. So I have a real personal interest in that, and that's part of the reason why the social justice part is so important to me.
Thank you for sharing all of that, and thank you to all of you for sharing your passion, and we're very happy that each of you are able to bring a unique perspective to this conversation. With that, given our current pandemic and the focus on social and racial justice these days, there are some particular challenges that overlay the challenges that pre-existed COVID and pre-existed the current focus. I don't want to say that all of a sudden racism is an issue. It's been an issue for a long time, and it's now getting really important attention. And I'm wondering from each of your perspectives, if you wouldn't mind, how are these challenges exhibiting themselves in the work that you're doing? What are your observations? And what are some of the initiatives underway to help address these particular issues? And I'd like to start with Supervisor Pine, if you would.
Okay, well, Scott Gilman and I will tag team this one.
Very good.
Thought I would start just talking about, you know, some of the unique challenges that we face now in this COVID era, and then turn over to Scott to talk to the initiatives we have underway. So, you know, one thing, of course, is, you know, mental health demand for mental health services has just skyrocketed. I read a recent CDC poll indicating that over 40% of people have reported at least one mental or behavioral health condition. In fact, that kind of strikes me as low, given the stress that everyone is under. You know, social isolation and loneliness is a big issue right now. The length of the pandemic is a challenge. I think when we started out, we thought it might be much shorter in duration. Then, of course, so many people have tremendous economic stress, and many sadly face unemployment. And the folks that are most affected are households with children, older adults, the essential workers who are out there every day. They are particularly feeling the stress of this period. While Scott will talk about some of the programs we have underway, one thing I did want to briefly mention is San Mateo County, of course, is facing the challenge of COVID every day, but we're also thinking towards the future, and we're developing a recovery plan. And this is an initiative that encompasses government and nonprofits and the private sector and various citizen leaders, you know, to think about, you know, how we can emerge from this trying period And one thing that has come up frequently in these discussions, is the importance of strengthening our mental health care system, and the recognition that, we really will be unable to have a successful recovery without really strong mental health services. Another challenge is access to mental health care, particularly during this time. I mean, prior to the pandemic, of course, the insurance limitations and the failure of the mental health parity law was a problem. Shortage of mental health providers has always been an issue. But now we have many practitioners who, of course, have to all, or most or all, have to move online. And I think Scott will talk about how BHRS has done that, and we have a lot of success stories. But there are many folks, particularly in vulnerable communities, who lack personal computers, they lack online access. So that creates a challenge. Another challenge too is in our residential settings, where particularly for potential new residents, how are they brought into a community given the threats of COVID? Another challenge is the budget. The major role of county government is to provide the social safety net, and we're needed most when times are most difficult and when the economy is most difficult. But of course, when that happens, our revenues are also become under stress and a decline. So prior to the pandemic, the county health system went through a long process to close a $57 million budget gap, which arose principally because federal reimbursements haven't kept up with the cost, particularly the cost in San Mateo County. And now with the pandemic upon us, we're seeing significant drops in our revenue, particularly our sales tax. So it creates a challenge. And then just very briefly, the long-term challenges that we face remain. Stigma is one we work on all the time. It's really terrific to have this series of talks and Let's Talk Mental Health, to really address stigma head on. And another is housing opportunities for people with mental health challenges, particularly people who are trying to step down from a psychiatric emergency type situation into a lower level of care. And housing is just an issue for everyone, and particularly an issue here for our in the mental health community. So those are some of the challenges I just wanted to kind of lay out there, and then Scott will tell you how he's going to get around them all.
Scott, you're going to fix it all, right?
Sure. Yeah, no problem. No problem. Just as soon as Dave sends us all that money. Well, I think Dave mentioned, substance use and the rates of relapse that we're having. One of the significant successes that we have going on in San Mateo County is our response to the opioid epidemic and the opioid use disorder. And so we have a medication-assisted treatment program where staff go right into the emergency room if somebody's overdosed or had a narcan where they've been reversed from the overdose, and connect them immediately to the medication. In the old days, substance abuse systems were over here, mental health systems were over here. Church was way over there, and physical health care was, back there. And so our first step, in San Mateo is putting substance abuse and mental health under the same umbrella. And so the IMAT team is one of our projects that we're doing that and having some pretty good success. So I think the statistic is 65% of the people with mental illness have a substance abuse disorder. So it's an expectation, not really something that is a choice to treat.
Scott,
I've gone so far.
Could you repeat the name of that team and what their function is?
Sure. Let me log back on here. I lost my camera.
We can see you.
Yeah, I can't see you, do I? There we go. It's the Integrated Medication Assisted Treatment Program. And so we call it IMAT. And it's a program where individuals are prescribed a medication that will help address their cravings, and making sure that they have a really solid treatment support system, and the staff work right with them, essentially take them right to the pharmacy to get the medication and make sure that they get what they need. And so this is a really life-saving program, making a huge difference for people. I think the other thing I wanted to mention is our crisis and trauma work. I think never before has it been as so important and so critical. We talked about COVID, we have the fires. We really started, I think, as a profession, really understanding trauma after 9/11 and how it impacted all of our first responders. People that have been in mental health for a long time, have a lot of traumatic things that have happened to them. They've been victimized, and a lot of times our system would make that worse. Come in and tell your story about your rape and your horrible childhood, and on and on and on, and then tell it again, and then tell it again. My own daughter has severe bipolar disorder, and I was in Michigan last week, and she was refusing to go in. She needs her medication adjusted, but she's like, Dad, I cannot talk about, she lost a baby. She says, I cannot talk about losing that baby one more time. And I just got on the phone, said to the therapist, we need to be trauma informed. We don't need to go through that whole process. And so our whole system is learning that right now, that when somebody walks in the door for help, instead of saying, what's wrong with you, you say, how can I help you? And so trauma-informed system of care is huge. We have training going on at all levels, from the front desk to psychiatrist, and in cooperation with other social service agencies. So police departments are working with us in law enforcement. So it's a really great partnership. I want to mention telehealth. Dave mentioned, Supervisor Pine mentioned, that has been one of our challenges. It certainly has. We had to get everybody out of the building essentially with about 24 hours notice when their first order came. And so really transitioning our entire workforce to telehealth has definitely been challenging, but it has had some wonderful payoffs. People who typically would not be able to travel or come in for care, or people who had a lot of paranoia about leaving the house, just transportation in the Bay Area, folks getting in and seeing a specialist. So our no-show rates have gone way down, and if somebody's not with a therapist, typically there's no progress being made. So people are showing up. Psychiatrists, are able to fulfill medications. We're also able to do a better job of matching people to the expertise that they need. So if you live in North County, historically, you'd get a therapist in North County. But if you happen to need an eating disorders therapist, and you're in North County, our specialist was down in South County. So now we can match people a lot better. So there's a lot higher quality, and it's much easier to do that. The other thing is groups. Group therapy is extremely valuable for many individuals. But again, transportation, and then trying to get people, I'm going to use eating disorders again, but trying to get, 7 or 8 people with eating disorders together was really hard in one part of the county. Everybody has to drive to Central or something. With telehealth, we're able to pull that off for people from all over the county. It doesn't matter where you live now. And so that's working. We're doing a sort of a pause right now, and because it's been full steam ahead with telehealth, but now we need to find out where it's not working for people. And that's a process that we've kicked off about 4 weeks ago, where we're having some of our clubhouses and different consumer operated programs are really going out and asking people what's working for you and what's not working for you. A lot of my therapists are telling me it's working for them. That's great, but I need to know if it's working for the folks that we're treating. And so that's happening right now. And I think the last thing I just want to mention is a really huge initiative that's coming out this year, is a restructuring of our full service partnership program. And if you're not familiar with our services, full service partnerships is our most intense wraparound level of care. And as soon as I walked in the door, advocates, consumers, stakeholders, full service partnerships is a problem. It's not working for my kid, my family member, for me. And so as we really step back and look at it, we agree. it's time for a restructure of full service partnerships. So we're in the process of gaining stakeholder input on an RFP, and that will be happening over the next year.
Great. Well, thank you for that. I don't know, it looks like you may have froze out, so I'm just going to jump in here and ask Dr. Nataleski, you come at this agenda, if you will, from a slightly different perspective as a private practitioner. Can you share a little bit about the challenges you and your colleagues are facing and some of the initiatives that are underway?
Sure. So from within private practice, I think probably just about everybody on this call could guess some of the stuff that's coming up. A lot of anxiety, a lot of fear, a lot of depression, a lot of uncertainty, a lot of adjustment to all the myriad of changes that seem to be coming at us, all of us. And so in private practice, that's what a lot of people are working with, is how to have skills, how to cope with this stuff, how to be healthy in the midst of so much uncertainty. From a psychological association end of things, some of our initiatives have been twofold. One, to support people in our community that might be using our services, as well as our other psychologists. So two different communities, so to speak. There's been some reference to the fact that there are not nearly enough providers. And so we're really trying to care for our providers, to make sure our providers are not burning out, to make sure our providers have the training they need to be handling some of what's coming at them. As I imagine everyone on this call is well aware, it is not one size fits all. So providers may be trained to handle trauma, but they're not trained to handle, we've used the eating disorders example, or trained to handle substance abuse, but not trained to handle acute anxiety with somebody who's having panic attacks. So making sure that people have the training for the work that they're trying to do and that they're kind of staying in their lanes, so to speak, to provide competent evidence-based care. And, you know, so we're trying to provide training. We're trying to help people understand how to do telehealth and to do it well. And there's a lot of transition from the provider standpoint of making sure everyone is up and running and HIPAA compliant to the best of our abilities. We're also trying to provide resources, both to consumers as well as providers, on how to cope with COVID, how to be able to access services. On our website, we've really tried to make it a resource for both psychologists as well as consumers to see useful information, both in the media as well as advice about sort of, 5 tips for handling getting back to school with kids doing distance learning, or information about how to get low-fee therapy in the midst of COVID. We've also tried to really address race and social justice. And so we've been providing resources and training there. We've increased our own metrics in terms of assessing diversity in our psychologists. We're hoping that will eventually translate into improving our Find a Psychologist feature on our website, so that consumers can search for psychologists not only by the type of service or therapy that they might offer, but as well as their background. So there's a lot of different directions we're trying to take some action in. And, my hope for joining this today is that if people have suggestions, and I imagine the other panelists would agree, I'm really curious and interested to hear those suggestions, because we'd very much like to make sure we're meeting the need as much as possible.
Thank you very much. For those who are not familiar with terminology, you mentioned HIPAA compliant. Can you describe in lay terms what that's all about?
Sure. Essentially, it's making sure that information that's transmitted electronically, so whether it's email, text, and teletherapy, all stays confidential and secure. And that would be personal information like name, date of birth, and other confidential information.
Thank you very much. Bill Crucy, share with us, if you will, your involvement and some of the challenges and initiatives that are underway in your world.
Thank you, David. The Spirituality Initiative is a part of the health equity initiatives. There are 9 health equity initiatives.
We're talking San Mateo County wide.
Yes, I'm sorry. Yes, I'm sorry. In San Mateo County, and they're racial equity efforts. They're all racial equity efforts. The Chinese Health Initiative is one of them. I'm going to let everybody know what they are, and I'll try not to just use their initials. The Pride Initiative, which has actually begun, it has a center now. The Pacific Islander Initiative, Native and Indigenous Peoples Initiative, the Filipino Mental Health Initiative, the African American Community Initiative, the Latinx or Latino Collaborative as well. They're held together by the Diversity and Equity Council. All of these groups meet monthly, and they work specifically towards the people that they represent. So for instance, the Chinese Health Initiative, let's just use that one as an example. Unfortunately, as we all know, this administration made COVID sound like it was a Chinese issue. So what they had to do was respond to the xenophobia that came up around it and the racism that some of their members were beginning to experience, and that some of the Chinese families were also beginning to experience. So they developed a training. And that was a very important thing. Some of us who were a part of that, we try to support each other. The Pride Initiative, they have a big events in June, and this year it had to be virtual, but they still carried it on, and every day for a week they had a different initiative or a different event that you could join, that the public could join free of charge. All this, of course, is free. The African American Community Initiative, of course, because of Black Lives Matter, is doing some trainings around this. And it causes those of us who are part of the Diversity and Equity Council to look at what it is that we're doing. I mean, Black Lives Matter. So what does that mean for those of us who are Caucasian, who are white? What do we do? And we know that the system it's built upon white people putting it together, quite honestly. I want to read a quote from Kareem Abdul-Jabbar that I heard I participated in a presentation. It was a nationwide presentation of African-American psychiatrists who spoke. He said, "Racism in America is like dust in the air. It seems invisible, even if you're choking on it, until you let the sun in, then you see it everywhere." Well, part of what we try to do as the Health Equity Initiative is to cast light on the inequalities that are in our systems. And so we work together. We work together to do different kinds of things that hopefully will cast the sun upon the inequities that are there. And I think that's a very, very important kind of thing. Actually, in different forms, the Diversity and Equity Council has been around for 25 years. It wasn't always called that, and it's evolved over time. And of course, one of our challenges, you ask what the challenges are. How do people, for instance, in the Latino Collaborative, the languages, we provide languages of language translation, and there are people who are bilingual. I mean, one of the things I will say, San Mateo County's done a good job of hiring bilingual clinicians, but how do you get to the people? I mean, with the fear that is out there in an immigration community, we know that there's mental health issues, but how do you get to the people? That's an ongoing challenge, and it always will be. We know incarcerations are high in people of color. So, those are the kinds of issues that we are struggling to somehow cast light upon and look at in a different way, so that we can come up with different ways of treatment for people. And so I really think that what we're doing, and of course we're being affected too by the budget. I think everybody's being affected by the budget, because we have half of the staff that we do the actual Diversity and Equity Council, or the Health Equity Initiatives have half of the staff. And because there's a hiring freeze, everybody understands that, but it sure makes it hard to do some of the things that we're doing.
Thank you for sharing that. For those of you who are working in the governmental sector, in the public sector, there's this thing called the Brown Act, which enables people to participate, to not just listen, but to actively participate in public meetings. Would you touch upon some of the committees, task forces, other opportunities that are underway that members of our community might be able to engage to help address some of these and provide the kind of input that Anna Nataleski had referred to?
Are you asking me, David?
Any one of you from the county. So Bill, you want to start?
Well, I can, sure. You know, I read you the names of the different parts of the health equity initiatives, and I gave you some examples. Each one of these groups meets monthly, and all the public is invited to any one of these groups. And you can, now that we're online, it's even easier in a way. And the way that you do that is that you would, I could give you a long, you know, thing in terms of how to contact, but basically if you just Google SMCBHRS, that's San Mateo County Behavioral Health Services, and then put ODE, O-D-E, that will bring you to, eventually that will bring you to the different health equity initiatives. You got to click 3 times, I think, is what I found in order to get to the health equity initiative.
Could you repeat that one more time slowly and then also add it to our chat line?
I will, yeah. San Mateo County, so SMC, Behavioral Health and Recovery Services, BHRS, you can use the initials, SMC, BHRS, space ODE.
Thank you very much.
And I'll put that in the thing. Then you can look and see when these groups meet, and you can, you know, you can join. Every one of these groups are open to the public. In fact, we encourage people from the public to be involved. That's what we hope for. That's our goal. The other thing I will say is that there's a lot of commitment and concern about how we continue under COVID. I appreciated what was said about the clinicians staying in touch with the clients. I think it is somewhat of a struggle, because after we had a meeting in April, our spirituality initiative, we just kind of did a check-in with the clients that were a part of our initiative, and we said, so how's it going? And you know, we found that in some cases things were going pretty well, but there were several of the people who were clients who said it's really getting difficult, and I'm seeing people slip back into their old ways of doing things, because it's very, very difficult sometimes to get hold of your. Now that was in April, and I believe what has been said that is much better, because I know that I think it has gotten much better. So, but it's something that has to be done. So what we did in the spirituality initiative, we just did some outreach. We just did some phone calls. Those of us who were in leadership positions just called people and said, so how's it going? What can we do? How can we I tell you this story because I know the other initiatives are doing that too. And I think it just shows the commitment that you know, people have in San Mateo County to help work with this situation.
Dave, is there, or Scott, are there anything you'd like to add?
Sure. When I was introducing myself, I mentioned 2 committees, which let me tell you a little bit more about those. So the county has a group called the Mental Health and Substance Abuse Recovery Commission, and it meets monthly. I think it has 19 members, and we're often looking for people to serve on that committee. And legally, half of the membership needs to be individuals who utilize mental health services or their family members. But even if you're not actually an official member, you're very welcome to attend the meetings or the subcommittee meetings. And the role of this commission is to, advise Scott and the Behavioral Health and Recovery Services Department and advise the Board of Supervisors. So we welcome everyone who has an interest in mental health issues and substance abuse issues to participate there. And then a second one, and it's very closely related, is our Mental Health Services Act Steering Committee. So again, the Mental Health Services Act is a tax of I believe it's 1% on people's income above $1 million. And it generates about $30 million a year for San Mateo County. And we have quite an extensive process of engaging the public to determine, how best to use those proceeds and how to set priorities. And it really is a very open and transparent process. I recall when the California Clubhouse was getting off the ground, it became very involved in that committee and was able to secure some funding, which was terrific. So those are two particular areas that I would urge people to consider. And we can post on the chat, how to find out more about those two committees.
I want to say Linda Wolin from your office has posted on the chat, for those of you who can look at the chat text, the health equity initiatives and the link for that, as well as the Mental Health and Substance Abuse Recovery Commission. And I want to re-emphasize, those who attend the commission meetings or even the Board of Supervisor meetings have an opportunity not only to listen, but to give input. So you don't need to be a commission or task force member to be an active participant. A mayor I once worked for used to say, democracy is not a spectator sport. So it's something that we all need to engage in. Anna, you had mentioned earlier a website. Could you restate the website's name and if you happen to have the address?
Yes, that's the San Mateo County Psychological Association, and I'll go ahead and put that information in the chat.
Very good, thank you. And are there opportunities for the public to engage in the work that you're doing from a policy or systemic perspective?
In terms of the Psych Association, absolutely. We have partnered a little bit with the community. We held some talks at the beginning of COVID that were just sort of open forum for people to join us and just sort of offer support. So that's one way we've tried to sort of be in touch with consumers in the community, but certainly there is contact information on our website. So if consumers have suggestions about, a group that they're looking for or a suggestion for services that they would like to see more of, I would say do contact us, and there's email as well as phone contact methods, and I'll put all that information in the chat because we'd like to know.
Thank you very much. So, is there anything more that any of our panelists would like to add before we open up for Q&A?
Yep. David, can you hear me?
Yes. Is that you, Scott?
I just really want to encourage people to feel free to call my office. I'll put that on there, or call the other panelists and discuss what sort of committee or what you're looking for. We've had people show up, to example, to the Mental Health Services Commission who really want to tell their story. And it's very frustrating for them because it really is a formal board process. And so we don't want to set people up for disappointment and frustration. And so, feel free to go to any of them. We'd be more than happy to talk with, with anybody, so answer any questions about any of these. Just don't want folks to be set up for disappointment.
I appreciate your making that comment. And I think all of our panelists have offered their emails, if not phone numbers as well, to follow up today's sessions. So through marcyb@comcast.net, if you are interested as participants to get information that you're hearing about, but maybe you're calling in, you don't have access to the chat line, feel free to communicate with us, and we will copy down all of these things that are in the chat line and make sure that we can make them available to you.
David, just one more point.
Please.
One thing now with everything being done online is it's a lot easier to attend the meetings. Oftentimes, or unfortunately, sometimes they're held during the day, so it's hard for people to get away. It's a little easier maybe to do it from your computer at work, but you can avoid the driving. We've found at the Board of Supervisors and really on all the various boards I serve on that public participation has really markedly increased because it's so much easier for people to attend a meeting virtually. And if you just want to kind of get a taste of what some of these meetings are about, that would be a great way to do it online.
Thank you. So to our participants, I can't emphasize enough, there are opportunities to engage and make a difference, and we hope that you'll be able to do so. With that, I'd like to take this opportunity to open up our chat line for any questions that people would like to ask of our panelists, or we'll take it from there. And Rabbi Delson, will you be managing this? How are we going to do this?
Sure, be happy
Okay.
to. Mm-hmm.
All right, so to our rest of our participants on this call, I want to ask Judy Cohn, I think you are online and you had shared a question. Was it addressed as it related to funding?
Judy, you can unmute yourself.
You might be muted, Judy. Are you online, Judy?
I am looking for her.
I know you were there earlier.
I have her question if she's not there from the email.
Go ahead, Marcy, if you would share it for her, please.
She'd like to know how the funding specifically allocated for mental health services that was authorized via a proposition a few years ago has impacted the organizations with which our panelists work, and if and how that additional funding has been used and or has not been helpful.
So I believe we're talking about the Prop 63 funds that are otherwise called the Mental Health Services Act, money that has been touched upon today. Is there anything more that Supervisor Pine or Scott Gilman you can talk about in terms of how those funds have been used?
Well, I'll start by just mentioning that the Prop 63, the Mental Health Services Act revenue is particularly critical right now because we had some money in reserves from the Mental Health Services Act that we've been able to use to close some gaps in our core service delivery. So it's really been kind of a lifeline currently. But Scott, I think you probably have some more to add.
Sure, yeah, I think you know, the whole issue of Mental Health Service Act dollars, there's a lot of debate, you know, at the state level, but locally, there's just been a tremendous number of things that have been done. Pride centers, you know, all of the health equity initiatives that Dave was talking about. You know, all of our full service partnership programs are funded with MHSA dollars. And so that's a significant amount of funding that goes into that. And of course, I mentioned earlier, we want to do a better job with that, but that also has about $2 million in it for housing. So it's a smaller part of our budget, 30 million, but there's a lot of great things, you know, that happen with that dollars. If people want to see, there's a formal report that's done annually that we have to publish. I can get the link and get that to you, David, if you want, but it has all the outcome evaluation data for all the treatment programs that is funded, and then all of, because there's many, you know, there's far more than I could ever get through in the rest of our time. But that report serves that purpose. It goes through every single program. What were the outcomes? Were they successful with the outcomes?
David, could I just speak up for respond a little bit to that?
Go ahead, Bill. Yeah.
I'll give people an I mean, what we do, what I've just been describing to you today would not exist if it wasn't for MHSA, more than likely. At least a large chunk of it would not. And I'll give you an example of something. Just this past Friday, the Native and Indigenous Peoples Initiative and the Spirituality Initiative had a drumming circle, which usually, you do it in a room together, but we worked really hard. We had a professional who has been working on this. His name is Dr. Sal Nunez, who's a psychologist himself, and we did drumming virtually. Well, I have to say, and that is part of the Native way of treating, because we do know that some of the Western ways of treating people, such as Native Americans, doesn't work. And so we try to explore ways. So this drumming circle we've done it several times, is a way that we try to speak to Native peoples, and for that matter, others. You don't have to be Native to have the rhythms of the drums that come up. I personally experienced, and I talked to several people it's very relaxing. It's very soothing. It gets rid of some of the anxiety. So that would not be possible if it was not for the MHSA.
Thank you very much for that. I noted I had mentioned earlier about the Brown Act and public meetings. It looks like John Butler is one of our participants who commented, and I believe it was in reference to that. John, if I'm getting this wrong, let me know, but that the public meetings, oftentimes the public are limited to 2 minutes of speaking per meeting. And while that is probably very true when it comes to the public meetings, I understand, though, that written material could be any length and submitted at any time to supplement and complement the limitations for the speaking. And so with that, there is always an opportunity to convey what is important through different modes, both writing as well as speaking at these meetings. John, did I get that right? That was the point you were making, or did I misinterpret? If you're able to unmute yourself.
Yes, that's what I was referring to. I understand there's a lot of things to do and time is essential, but some of us in the past have been cut off at public meetings, and then the meeting ended up ending early, and that made no sense to me. So that's why I commented on that.
I appreciate the comment, and I know from experience that can be very frustrating, particularly when you feel there's a lot to be said. Again, as laborious as it might be to put the things in writing, I know it is another alternative way to supplement and complement what one might say publicly at these meetings. And it's important to know that that opportunity is there. Thank you for sharing that, John. Is there anybody else that would like to ask a question?
We haven't received any other questions in the chat,
Okay.
but I can ask one as on behalf of our congregation and all faith communities who are joined with us today.
Thank you.
And it's something that Bill and I have spoken extensively about over the past few years in our work, particularly for the National Day of Prayer for Behavioral and Health Services. So what are the ways that those who are participating in faith communities can partner, and maybe not physically partner or partner with you in terms of the county or on the supervisor level, but what are the ways that you have observed that faith communities can do better in supporting people who are struggling with mental health?
Well, first of all, Rabbi Delson, thank you and you are right. You know, we've been talking about this for the last 5 years. We do have a National Day of Prayer for mental health, and it's totally interfaith. And we find that it's been very powerful, and you have been the one that, you responded first. When I called you or contacted you or however it happened, I don't remember how it initially happened, but without hesitation. And that's the way that, in part, the what it is that you all, for instance, are doing today. Faith groups, and there are other faith groups that have these kinds of conversations. I must admit, I'm not totally aware of all of them. I know that the Presbyterian Church, I know, has these kinds of things. But it does take a partnership, because one thing we do know, and Rabbi Delson, you and I have talked about this, the first place that a person goes to is usually to their clergy person or faith leader, because some, like in Hinduism, they're not called clergy, they're just leaders. So however it is, that's where the people tend to go first. So one of the ways is that I think that faith groups can try to educate themselves, and I know your congregation has. I know other congregations have. There is a first aid training that faith groups can come, learn from, and that's free. There's no charge for that. If you have members, yes.
When you say first aid, are you talking psychological first aid?
Yeah, I'm sorry.
That's all right.
Yeah, mental health first aid, I think.
Thank you. Yeah, mental health first aid is exactly right. I think within congregations, just to be aware of people and their changes. And as a clergy person, it's important for us to learn over at least a period of time some of the things that we look for, and to train ourselves. So it is a collaboration. And we, as a Spirituality Initiative, would be happy to be, in any way we can, to be supportive of you, to get the resources that you might need. I think I put my email address in the chat. If you want me to say it, David, I can. It's
Yeah, go ahead.
BKRUSE and it's my church, churchfortoday.net. So it's BKRUSE @churchfortoday.net. But we are very happy to work with you. Maybe you want the African American to make a presentation on Black Lives Matter and the racism that is in our system. So I mean, those things can be we can help you with.
Thank you very much. Please go ahead, Anna.
I was just going to jump in as well. I think I agree. The dialogue is very critical. The other thing that I would add is just helping to normalize and destigmatize seeking help is phenomenally important and a big part of being a partnership. Even though I think we live in a place where people are open-minded in many ways and educated about mental health issues from an intellectual standpoint, I think when these things hit close to home, we revert back many times to things we learned earlier in life, to different places maybe where we're from, just the beliefs that don't always make seeking help feel like an option for us. So to normalize seeking help and professional help at that as something that's always an option, and sometimes even having, this is a website, or this is a number you can call, or this is a agency that might be able to help, so people also have an action step, is really helpful and important.
Dr. Nataleski, it looks like we have a question for you. What practical advice can you give to those who right now are having trouble coping with isolation and worry?
That's a great question. I would say there are small steps. These are Band-Aids, sadly, because I think the isolation and the worries keep coming at us. So doing things that you can each day to maintain energy. So looking at your sleep. Are you sleeping enough at night? How are you eating? How much time are you getting talking with other people? Sort of your social interactions, whether it's with family or other loved ones, friends, from a safe, socially distant perspective, so that we're also physically healthy. Managing physical conditions. And then from an emotional level, I think a huge first step is really being mindful of what your worries are. Oftentimes our worries kind of seem like they're underground, in the sense that we have this generalized sense that something might be bothering us, but we can't quite put our finger on what it is. So taking the time to just be curious, What is it I'm worried about? What are some of my worst case scenarios or fears? That takes a phenomenal amount of courage, but it's a great first step in kind of knowing what's going through your mind and what's taking up your emotional energy and kind of getting through each day. And then other coping skills, you know, I mentioned sleep and eating and reaching out to people, but also very much speaking with a therapist or another professional or trusted person in your life about what's going on and what you're worried about, and asking for help.
Thank you. I have a follow-up question for you as well as for Scott. I'd like to know whether any of your therapists or yourself are involved or have this experience. There are pre-pandemic chronic mental health conditions that may have existed, such as fear of germs or fear of going outside. And now all of us are experiencing, to a greater degree perhaps than pre-pandemic, fear of germs and fear of going outside. For those who had chronic conditions of this nature prior, what are you seeing this exacerbating or somehow even validating some of the fears that they, from their perspective, validating their fears? And how do you deal with that as clinicians?
Definitely exacerbated. And we're sort of speaking around the condition of obsessive compulsive disorder, or OCD. And for people who have had some treatment with OCD, we have a type of treatment called exposure response prevention, or ERP. And so I would really encourage people who've had some of that treatment to remind themselves of the idea of, just because we believe something is a germ or it's a contaminant of some sort doesn't necessarily mean it's true. And that's a cognitive strategy, right? To think through, this is something, if I touch this, what will this do? What will this mean? And that's sort of the exposure of saying, well, you know what, I touched that doorknob. And yes, I do need to wash my hands, but 20 seconds is sufficient. I don't need to wash my hands 10 times. And that's the response prevention, is preventing yourself from doing the overly compulsive reaction to the exposure. I know that's a lot of terminology in there, but tell me, did that make sense to everyone?
Absolutely.
Okay.
Scott, is there anything you would want to add?
Yeah, I think one of the things I want to mention is we've seen our rates of relapse just going through the roof. And so it's too early for me to have specific numbers, but detoxes and then our inpatient psych admissions have gone up. What we saw, the demand for services didn't come like we thought right after the first, the shelter in place order came. I think, at least my experience is many individuals with severe mental illness can really suck it up when they have to for a while. And they do probably better than a lot of us. But that only lasts for so long. And then it's really bad. And so that's what we're seeing, is that the phone calls, the crises that we're getting now are really serious. Clinicians' time on the phone is significantly higher than it was. And so I think it's the long chronic exposure to the stress and the trauma that they're having is really exacerbating all of the symptoms, not just OCD. You're seeing them in just about in every area that I can think of.
Thank you. We have a question from Lauren Schlesinger. You wrote it in the chat, and I appreciate your doing that, but I wanted to give you the opportunity to share out loud your question about the challenges of, or as the private, you can describe your question better than I can. If you would share it for those who maybe don't have access to the chat, and then I'm going to ask Linda Wolin if you would share the resource that you provided in response. Lauren?
Yeah, sure. So I was just sitting here thinking about all the amazing resources that have been shared, and my understanding is that even those are a fraction of what's available in San Mateo County through other nonprofits, for example. And I'm just conscious of what I might not, of what I know and what I don't know, and how even that's so much more than the average resident. And I wonder if there's like any place that someone can go just to get a sense for the different resources, mental health that are available. And I appreciate that link, Linda. But I was thinking even beyond the specifics of COVID. Does that help clarify?
Yes, thank you. Linda, do you want to share what you did in the chat? Linda Waller.
Well, just for everyone's information, I put in the chat 2 general resource pages related to COVID specifically, but one for mental health that's on the health department website, and then another that's on the county manager's site for general COVID-19 resources. And then I just make the comment that we've really been struggling, our communications department, with communicating so many things in the middle of COVID, you know, building the airplane while we're flying, but also trying to communicate what's going on just with the changing health orders and the available resources. So we're doing a lot of things, and it's definitely a challenge to be able to share out what all the resources are, and particularly to make them language and culturally appropriate for the very at-risk groups that may not even have internet access. So it's an ongoing challenge, and we would appreciate any feedback anybody would have about how to present that better.
And maybe I would just finish by making a plug for an organization for which I serve on the board, which is Adolescent Counseling Services. For anyone who might have youth that are impacted by COVID or other pre-existing conditions, they are actually able to deliver therapy on very quick turnaround. I know access can be a real challenge. So just being a good board member and getting the word out.
Could you repeat the name of the organization, Lauren?
Adolescent Counseling Services.
And if you could put their link on the chat line, that'd be great.
You bet.
I got
yes.
another question.
I was about to ask you.
Yeah, about access as well. When a person, this is a question that came to me privately, when a person needs a therapist or psychiatrist but can't find one on their insurance, or maybe they don't have insurance, what do our panelists recommend as a first step?
I can take that, David. It's called the BHRS Access Center. And so that's typically business hours, but after hours we have a crisis line for folks. So the Access Center will work with somebody who doesn't have insurance. It's not required to come into services with us. If they do have insurance, we will try to point them in the right direction. But I heard somebody mention parity earlier. Sometimes individuals that have a third-party insurance run into issues of the insurance companies don't really pay for what they need. And so that can be a double bind for people, or the insurance companies deny the services. And in those circumstances, we encourage people to talk to the insurance commission, and we'll help people advocate if necessary to get the benefit, you know, that their employer has paid for, you know, that they're entitled to. And so Access Center through BHRS would be the great starting point. And then any of the health equity initiatives that Bill talked about also can help get people connected as well. I also mentioned the people that have employers, their EAP, can also, if they're fortunate and have an employee assistance program and have insurance, the employee assistance program will typically meet with somebody for 1 or 2 sessions and then connect them to somebody that takes their insurance.
Thank you. John Butler, you had asked a question of Dr. Nataleski. Would you mind sharing it out loud so that those who don't have access to our chat can see or hear what you had to ask?
Actually, she kind of answered in the chat, but I'm open to hearing from others about it. So for underserved communities, Latinx, African American, and so on, there aren't enough psychologists, psychiatrists, there's supposed to be something like 2.3% in the nation that fit with those cultures. So what efforts are being made to bring in more people from different cultures to speak to the underserved communities?
Great question. Dr. Nataleski, you had a response in the chat. Would you like to share it out loud?
Sure. So this isn't fully baked just yet, but the San Mateo Psych Association is in the process of partnering with an organization to offer pro bono therapeutic services to undocumented individuals. So that's just one section of underserved people. We're also in the process of partnering with the San Francisco Psych Association, the Santa Clara Psych Association, and some other neighboring psych associations to create what's called the Greater Bay Area Diversity Coalition. And through that, we're hoping not only to increase our training of our psychologists, as well as really come together and make sure that we are combining resources so that people can seek out trained clinicians in different areas and have different fee schedules and insurance acceptance rates and all these things. So we're trying to make it a little easier for people to find what they need.
It sounds like in terms of the, I'll come back to you just a second, John. I wanted to mention that it sounds like, Dr. Nataleski, that Bill Crucy's work in diversity and inclusion might be a good partnership with the work you're trying to do in terms of expanding diversity and access.
I agree.
John, you had another thought?
Well, I'm just curious, does that coalition currently exist, or is it just being formed?
It's being formed right now.
Okay, and the Diversity and Equity Council, which is like overseeing the health equity initiatives, is an excellent source to work with that Bill was talking about.
Wonderful.
I wanted to ask, Linda, I don't mean to put you on the spot here, but when we were talking in preparation for this, you had talked about some additional work being done in the county around diversity. Could you expand on that?
That is putting me on the spot, but
Yeah.
in response to some of the ongoing national challenges, the Board of Supervisors is putting renewed emphasis on diversity and inclusion, and it's information. We already have an Office of Community Affairs that is exactly been working with the at-risk communities for some time now. Maybe Supervisor Pine can help me with how long, I think 2 years, but has been focusing on immigrant services and census response rates, and also helping other departments around the county communicate with at-risk groups in language and cultural sensitivity. And that office is going to evolve or partner with a new Office of Diversity and Inclusion to be housed in the county manager's office. It's still in progress.
Thank you very much. And for those of you who don't know, Linda Wolin is not only a congregant at Peninsula Temple Shalom, but also works out of Supervisor Pine's office. And we really appreciate all the support you're providing today. And thank you for letting me put you on the spot. Is there anybody else that would like to ask a question or make statement for our panelists?
We have one more question in the
Please.
chat.
Go ahead.
And I'll read it out loud, Carol, unless you would like to read it yourself.
Carol Gosha, how are you?
Hello. Can you hear me?
Yes, we can.
Okay.
Would you like to read your question out loud?
Hi, David. Yes, the question pertains and is addressed to Scott, I guess, and maybe Supervisor Pine, regarding the discussion going on now in the country about law enforcement as it intersects with mental health, and particularly 5150s. Is there going to be any discussion, Scott?
Scott, in answering, I'm sure most people know what 5150 is a reference to, but would you please just put that in English for us, and so everybody's on the same page?
Yeah, I think the best way to think about it is involuntary admission into a mental health inpatient unit.
Thank you.
So, yeah, Carol, it's so nice to see you too. By
Nice to see you too. Welcome back.
Thank you. Yes, the commission that Supervisor Pine talked about earlier has kicked off a subcommittee, and we're fortunate on the commission to have three. One current, Captain Mark Dury, is a member of the committee, and then Chris Rassman is a retired Redwood City police officer, and then Don is also a retired police chief. And so those three individuals have a lot of expertise and a lot of personal passion to really help lead the discussion on our side of it, you know. And so taking things like our PERT, our SMART, you know, all of the programs that we have our homeless outreach teams that, you know, that do this. There's so many things. And so the commission has said that they want to provide a leadership role in having some public discussion about that.
Great.
We have to coordinate, of course, closely we don't want to get ahead of, county manager or board of supervisors, but, to have recommendations ready, when the time comes. We're also beginning to advocate and encourage people to review the Sequential Intercept model, which talks about a full continuum. It's a framework for a county discussion or a community discussion. Whenever you talk about the intersections of law enforcement and mental health, if two people are talking about it, they're talking about two completely different steps in the process. One person might be talking about jail diversion, they might be talking about post-booking, another person might be talking about that first time the person trespasses in the park. So the sequential intercept model structures it so you can take all of the programs and interventions that a community might have and put them, basically think about it as a continuum from very, very first intersection in the 911 call, or even good crisis work before there was law enforcement, all the way through, release from prison, essentially. What are all of those programs that you have? And so we're really trying to advocate that we don't just look for that one quick fix, because those of us that are in the business know it's not going to be, you can't go build a building and fix this. You can't do a training program and there it's going to be better. It has to be the whole thing. And so to have a community discussion, we have to have a framework that says, okay, if you're talking about that, are you talking about it when they had their first arrest? Are you talking about it when they just got out of jail and they're for housing and they don't have any money? Where in the continuum of intersections are we talking about? So thanks for the question, Carol.
Thank you.
And I might add that the Board of Supervisors is very supportive of looking at new ways to respond to health emergencies with less law enforcement presence. Sadly, we had 3 folks die in the county with taser-related incidents, and in each case, the person had mental health challenges. So that really put a spotlight on the need to do better. One thing we did right away was we do have the Psychiatric Emergency Response Team, which we refer to as PERT. And that team consists of a deputy sheriff and a mental health clinician going to a scene or emergency situation. And we recently added a second PERT team, but there's a real interest in doing more because we just appreciate the high degree of risk when law enforcement and severely mentally ill people intersect, and we'd like to do more.
Great.
I'd like to mention briefly, Carol Gosho sits on the board of the San Mateo County NAMI, and you have a fan out there, and Sharon Roth, asking why hasn't NAMI been discussed in our conversation so far. And indeed, we were going to give you a shout out at the end of our session today, but is there anything, Carol, you'd like to say about NAMI's involvement with county services?
Well,
talk about putting you on the spot.
Yeah, NAMI with county services.
Right.
Well,
or let me put it this way, for services in San Mateo County, not necessarily government-based services.
Yeah, we do. We do have all of our education and support groups, the family-to-family, peer-to-peer, family support groups, peer support groups, all online now. And that is one of the positives that many of you have mentioned, that we can reach many more people because they don't have to leave their homes. And so we are able to do that. We do have a warm line that could be bolstered more with technology. Technology is a big issue, and I'm wondering if the county has any plans to provide stronger internet access for everyone in the county. Is that an issue? Because we may be doing more of this on an ongoing basis from now on, going forward. So I'm wondering if, since we're in the heart of Silicon Valley, if that would ever be something that would be on the agenda for the county.
Yeah, sure, I'd be happy to speak to that briefly. You know, over the last number of years, through our Measure K funds, Measure K is a 1/2 cent sales tax. We've been able to do a lot of investments in creating Wi-Fi hotspots in areas that are underserved by the commercial market. And so that's been a big success. And now we all are aware of how difficult it is for many students to do distance learning because of
Right.
a lack of personal computer or many times poor internet access. So the board recently entered into an initiative with a couple of school districts in the southern part of the county to improve internet access for those school communities. So we've made some progress there. You know, someday we really got to look at broadband connection as
Right.
as electricity or water and
Yes.
needs it. But we've made some strategic investments in recent time.
I want to be sensitive to our time. We have about 5 minutes to close out our session today. I wanted to mention Pat Way had shared that there's a presentation on PERT at the September 2nd commission meeting. Which commission is that, Pat?
That's the commission we've all been talking about, the Mental Health and Substance Abuse Recovery Commission. The meeting will be September the 2nd at 3:30 in the afternoon.
Very good. Thank you for raising that and sharing it. I would like, as I begin to close out, want to remind everybody to, if you're not already getting direct announcements from the Let's Talk Mental Health team, to please share your contact information at marcib@comcast.net. I also want to do a shout out to Peninsula Temple Shalom for being our sponsor for the Let's Talk Mental Health series and supporting our efforts all along the way.
Yes.
And also to my Let's Talk Mental Health team members, Marcy Benson, Judy Cohn, and Marcia Mayer. Marcia, there was a couple other shout outs you wanted to make. Would you do that, please?
Yes, I'd like to give a big shout out of thanks to NAMI San Mateo County and California Clubhouse. They have been supporters of all of our programs and they help us spread the word. And I feel that only when we all come together like this do we form a positive, productive community. Right now, both California Clubhouse and NAMI San Mateo County have a Zoom opportunity that each of you can be a part of, and I want to tell you about them. California Clubhouse in San Carlos is based on a Clubhouse International model, and there's 300 of them throughout the world. Right now, they have something called a daily evening chat. They're free, they're open to the greater community, and they're on Zoom on their website Monday through Friday from 5 to 7 p.m. And it's a safe way to connect and socialize with others. I have posted everything there in chat, but their website is californiaclubhouse.org. And when you get to the site, you click on Virtual Clubhouse and you find the Zoom link. NAMI San Mateo County also has a wonderful Zoom opportunity. They have a program called Connections Online, and that's every Monday and Thursday from 7 to 8:30 p.m. That's a free peer-led support group for adults living with mental illness, and they discuss the challenges and successes of others in a very safe environment. Their website is namisanmateo.org, and when you get to that website and you scroll to the bottom, you find Connections and you find the Zoom link. And I'm going to use this as an opportunity to tell everyone about Let's Talk Mental Health and our final program for 2020. It's going to take place on Sunday, October 25th. This will be the third time that we do a program called In Your Own Voices. It will be 3 brand new speakers you haven't heard before, and NAMI San Mateo County trains these speakers, and they are persons who live with mental health conditions but lead very fulfilling lives, and they will share their story. So put Sunday, October 25th at the same time, 3 o'clock on your calendars. Thank you.
Thank you, Marcia. And Rabbi Delson, will you bring us home with closing inspirational thoughts?
Sure. So we are in the Jewish community in the month of Elul, the month leading up to our high holy days, Rosh Hashanah and Yom Kippur. Rosh Hashanah is the new year. Yom Kippur, just 10 days later, is our Day of Atonement. And so we take this month ahead of those holidays as a way of self-reflection. And during this month, each day we hear the sound of the shofar, which is a ram's horn that we blow particularly on Rosh Hashanah and Yom Kippur, but also every day leading up to these holy days. And the shofar is our call to action. It's to wake us up to our better selves and our better society. We are grateful for the community partners who take care and take action for those who live with mental health challenges. And may it be so that each one of us has the opportunity in this coming month to hear that call to action for whatever reason it is, whether it's reducing stigma, whether it's providing care and concern for family and friends, whether it is taking social action in order to provide help to those who are underserved. And I will conclude with a blessing that is the one that we say when we hear the sound of the shofar. Baruch atah Adonai, shomea kol shofar. Blessed are you, our God, Adonai, who commands us to hear the sound of the shofar. Amen. Thank you all for joining.
Thank you, everybody, for your time. Thank you to our panelists for volunteering your time. So appreciate it. And may you all find moments of peace during this time of stress. Take care. Closing up. Thank you. All right. There was one question I noticed from Stephanie Yang, but Michael Lim, thank you if you're still online for answering her question. She saw that. And I think otherwise we covered everything.
We are going to be putting this recording on a YouTube channel from Peninsula Temple Shalom, and we hope that it will happen fairly soon. So that is one way to get a recording. If you would like to email me, Rabbi Delson at shalom.org, I can also send you a link to the recording.
Very good. Thank you, everybody. Signing off.